Hi, my name is Katrina Silva, and today my patient is a 28-year-old female who is presenting with a chief complaint of wheezing. So I'm going to go in and talk to my patient and get a health history on her of what's going on today. So she tells me that this was a sudden onset this afternoon. After she finished having lunch, she had a peanut butter and jelly sandwich, and about 15 minutes later, she started with the wheezing in her throat and itching throughout her, generalized throughout her body. I do see some blotchiness of erythema on her cheeks, some on her neck, her chest, and her palms. She tells me that this has not been going on for very long, less than an hour. She came in immediately when she felt her symptoms because this has never happened before. She tells me that she's not in pain, she's just very uncomfortable, and that this is not radiating, these symptoms are not radiating to any areas of her body. On her way in, she did have some Benadryl, which helped alleviate some of her symptoms, but nothing has made the symptoms worse, which is good for her. And this has not been intermittent on and off, it's been consistently like this since she ate her peanut butter and jelly sandwich. So with that known, I'm going to ask her a little bit about her family history. She tells me that mom and dad are both alive. Her mother does have a diagnosis of asthma. Her father has a diagnosis of hypertension. She has a younger sister who is healthy, alive, no medical diagnoses. She has all four of her grandparents who are alive. On the mother's side, her grandmother has a diagnosis of dementia. Her grandfather has COPD, emphysema, and was a 30 pack a year smoker. As well as on the father's side, grandmother has a past medical, a current diagnosis of hypertension, and her grandfather also has hypertension and diabetes mellitus. So then I'm going to ask her a little bit more about her childhood conditions as well as adult conditions, and she tells me that back in 2001, when she was 9 years old, she was hospitalized briefly for the chicken pox. She was never vaccinated for that. And in 2011, she did have outpatient surgery to remove her wisdom teeth. So with that known, I'm going to start thinking about some of the reasons why my patient could be experiencing wheezing, and I tell my preceptor some of the ideas that I'm having are anaphylaxis, mediastinal mass. She could be choking on a foreign body in her airway. She could have Ludwig's angina, which is seen in younger patients. She could be having a retropharyngeal abscess, as well as asthma. So I'm going to prove to my preceptor that I believe she has anaphylaxis and not a mediastinal mass. Today specifically focusing on thymoma. There are other mediastinal masses, but today just talking about thymomas. So looking at the onset of both of these diagnoses, thymoma is a very progressive onset. It takes a couple of months for patients to even notice the symptoms. And the onset for anaphylaxis is very sudden. This is a medical emergency and needs to be treated immediately. So the risk factors for thymoma are paraneoplastic disorders. Most commonly seen is myasthenia gravis. 1/2 of patients with thymoma do have myasthenia gravis. And the great thing about this is that the neurological symptoms can kind of tip off the provider to check for thymoma. With the resection of the thymoma, some of these neurological symptoms will minimize, but they won't usually go away completely. And this is seen equally in men and women. The patient could also have pure red cell dysplasia, which is a hypoproduction of red blood cells in the bone marrow. They could have immunodeficiency, as well as thymoma-associated multi-organ autoimmunity. Sorry, that's a long one. And this is presented as host versus graft disease. So going over for the risk factors for anaphylaxis, you want to be focusing on risk factors that would have presented in the last 24 hours, honing in on the 2 to 3 hours before the onset of symptoms. So typically in childhood to young adulthood, you'll see the onset reason be because of food. Insect stings are more so seen in middle to older adults. You want to ask them about physical activity as well, because if the patient ingested any food or medicine and then exercised or did some sort of physical activity, this can increase the onset time for the symptoms. You want to ask about environmental exposures to heat or cold, which can trigger anaphylaxis, as well as asking them about nocturnal anaphylaxis. These are more rare, but it does happen specifically with the chemical alpha-gal, which is found in red meat. This one has a prolonged onset, more 4 to 6 hours, because of the digestion of the food first. You can also see this with kissing bugs. The saliva is usually what causes the reaction, and they do tend to bite at night, just like pigeon ticks, which tend to bite at night as well. You want to ask about any underlying diagnoses such as asthma, COPD, CAD, and mastocytosis. And then you want to ask the patient about all meds that they have ingested within the past 24 hours, including over-the-counter meds, recreational drugs, and any ingestion of alcohol. So looking at some of the symptoms for mediastinal mass thymoma, you're going to see the patient present with chest pain, cough, shortness of breath. They could be hypotensive, hoarseness, hemoptysis is seen at times. They could be presenting with stridor even, and in some cases superior vena cava syndrome, which is the swelling of the upper extremities and the face due to vascular compression. And then I have here highlighted in circles some of the symptoms that you're going to see from the paraneoplastic disorders like myasthenia gravis or immunodeficiency, which could tip you off to thymoma. So with myasthenia gravis, you're going to see diplopia, ptosis, dysphagia, weakness, and fatigue, whereas with immunodeficiency, these patients are going to have recurrent diarrhea, recurrent infections, and lymphadenopathy. The symptoms for anaphylaxis typically present as generalized hives, pruritus, swelling and erythema, flushing. They're going to have chest pain. They could have the swollen lips, tongue, and uvula. They're also going to present with things like the wheezing, the stridor. They could even have a decreased peak expiratory flow rate, as well as hypoxemia. And you want to also look out for more severe symptoms like hypotonia, syncope, incontinence even, and then abdominal pain and vomiting, nausea, which does present in some anaphylactic reactions. And then just to confirm this diagnosis, you want to check in with some testing for these diseases. For thymoma, this is typically incidentally caught on imaging that the patient is coming in for other reasons, like a chest x-ray, an MRI, a CT scan. You can check for tumor markers for thymomas, but the gold standard is to take a biopsy. Whereas for anaphylaxis, like we talked about, this is a medical emergency. Our number one priority is to treat this patient first, and then we can refer them to a board-certified allergy specialist, which will go over all of these risk factors with her more in depth so that they can pinpoint the reason of her anaphylaxis and prevent another reaction from happening. So this concludes why I believe my patient is presenting with anaphylaxis today.